Is it okay to spay an older female dog? What are the risks? What are the benefits? Well, that's what I'm discussing today. So question number 2 is from Court Mickey, who writes that her female Chihuahua is 8.5 years old and not spayed. So she's never tried to run away. She's a house dog, but for health reasons, Court Mickey is considering getting her spayed and wondering if it's worth doing it at this age, at 8.5 years of age, or is she, just too old to spay? Is there no point? So really, if we're thinking of spaying, there are 3 big reasons and benefits for spaying a dog. The first of those is to prevent pregnancy. The second is to prevent a condition called Pyometra, which is an infection of the uterus, where the uterus effectively becomes a big balloon full of pus. So it's really horrible. It's potentially life-threatening, and I'll get onto that in just a minute. And we also want to reduce the risk of mammary tumours. So that's the other big benefit of spaying. Now, at 8.5 years old, we're less likely to get pregnant. Certainly older dogs can still get pregnant. She's also a house dog, so she's probably unlikely coming into contact with entire male dogs. So that's maybe less of a risk and less of a consideration with this particular Chihuahua. There's also less benefit for a reduction in mammary tumours in older dogs. So we tend to think that if we're spaying before that first season, we get about a 99.5% reduction in the risk of mammary tumours. If we're spaying before the second season, it's about a 95% reduction, and before the third season, about a 75% reduction. Now, after that, there doesn't seem to be such a big difference. Though, having said that, there does seem to be an increased survival if an animal has been spayed within 2 years of mammary masses developing. So mammary masses are really pretty common in entire animals, and about 50% of those that do occur are nasty malignant tumours. So that means they can spread to other parts of the body, and they can ultimately be fatal. Benign tumours can grow very big and can cause severe problems as well. The 2-year survival of from mammary cancer is better if a dog has been spayed within the last 2 years. So, there's still going to be a slight benefit, I think, from that point of view. Now, moving on to Pyometra, so this infection of the uterus, really 1 in 4 female dogs will develop Pyometra by the time they get to 10 years of age if they remain entire. Now, this condition, it does have about a 95% survival rate if it's treated appropriately, but this does require kind of expensive emergency surgery in the majority of cases. Now, some can be managed medically, but these are really the minority of cases where this is preferable. Emergency surgery is generally gives us the best outcome and is the preferred treatment. And either way, both are still kind of severe interventions, and they're expensive treatments that carry some risk as well. So those are really the benefits of spaying, and I think that kind of highlights the fact that in an older dog there still is going to be a benefit to getting them spayed at this age, and even later. Pyometra is that common, and it's much better to have an elective surgery when a pet is otherwise healthy than to wait until they're really sick. There's also going to be a big cost difference there as well, which is maybe something to consider depending on your kind of financial circumstances. Now, having said all that, there's no such thing as a no risk procedure or no risk surgery procedure. So the risks of spaying are that an anaesthetic and a surgical procedure does carry some risk. That risk is going to depend to a certain extent on the health of the individual. We can do pre-anaesthetic blood testing to check that the liver, kidneys, and rest of the body function seems to be working well. We can give IV fluids, so intravenous fluids during the operation, and I think that's not an option. That's really a necessity for an older dog like this. And really, unless there's specific individual concerns because of other diseases being present, or maybe blood test results showing that there may be something else going on, the risk of surgery really is very low, and that's in a young dog and in an older dog. Now, there are also potentially some side effects to being spayed. There are some potential risks in certain breeds if spayed before 12 months of age. So that's cruciate disease, bone cancer, and numerous other ones. There doesn't seem to be any risks, or there's no known risks in spaying a female dog older than that in an older, so certainly an older dog. I don't think we need to be worrying about these things. And I've actually got a separate piece over on ourpetshealth.com that really is a comprehensive review about the risks and benefits of spaying a female dog in general. So that's more targeted at kind of younger dogs, so whether we should be spaying at 6 months, at 12 months, or maybe not considering spaying at all or until they're an awful lot older. So definitely go and check that out at ourpetshealth.com, and I'll leave a link in the show notes as well. But, I guess the summary is that yes, I think it's definitely still worthwhile to get an older dog spayed. We're going to potentially avoid some really emergency conditions, and I think a lot of the potential side effects of being spayed are not going to be a risk in an older dog compared to getting a younger dog spayed.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.